مش معقول.
Welcome to our newest episode of the Lebanese Physicians Podcast. This is episode number 93. And today we will be discussing the role of AI in clinical care and leveraging AI in that aspect. And our guest today is Dr. Hussain Ismaeel, and this episode is co-hosted with MohammadAli Jardaly. I will just do a brief introduction of Dr. Ismaeel. I knew him from the days of high school, actually. And then he was 1 year ahead of me in medical school, and he did his cardiology fellowship, then ended up doing cardiac imaging at Harbor UCLA at the Cleveland Clinic, and then went back to Lebanon, worked for a good number of years at AUB, and recently, in the past 4 years, he has moved to Qatar, where he works at Amman Hospital. Dr. Ismaeel has been very interested in AI and its applications in healthcare, and actually and he can talk to us more about this, but he has had a lot of certificates in regards to that, and is part of a startup at this point, leveraging AI in healthcare. Welcome, Dr. Ismaeel. Welcome back, MohammadAli Jardaly. We haven't seen you for a long time.
Thank you.
It was a rough few months. It's good to be back.
So, Dr. Ismaeel, can you share a bit about your journey from medical school to where you are now?
Well, thank you for the intro and the invite, Khalil. It's been quite a while since I've last seen you, and Muhammad also. Medical school to here, I think it's could be summed up by simple statement, which is basically always getting excited about what's new and jumping onto the wagon early, and then finding out whether to stay or not. That's basically my journey. So after medical school, I was fascinated at that point of time with the possibilities offered by genetic engineering and gene therapy. So I did my molecular genetics postdoc fellowship at Harvard Medical School at Mass General Hospital. Found out a lot about it, got my NIH grant, and then discovered that this is not the place that I want to be in basic science, etc. So made a shift, went back into clinical, did my cardiology training, and this is when I started developing an interest in cardiac imaging specifically. Back in the days, cardiac imaging was very new. And after I trained at it and at Harbor UCLA, came back to the region, and I was the first actually in Lebanon, and maybe there were a handful of us only who are cardiologists who are trained in cardiac imaging in the whole Middle East area. That was back in 2009, and since then, I started working. I worked in different settings, private, academic, for the last 10 years. Before coming here to Qatar, I was at AUB MC, and this is where I started, learning more about artificial intelligence, which was about 14 years ago. And my partner in crime, who's currently the associate dean of the School of Engineering, Professor Ahmad Al-Haj, he was the person who dragged me into the field of AI 14 years ago, and we started getting grants, doing some research, and I actually had a patent from Lebanon about digitization and image processing for digitization of electrocardiograms to be utilized in machine learning algorithms. And eventually, after August 4 blast in Beirut, I took the decision that the last straw has been broken. And that's when I decided to leave and bring my family and move to Qatar to embark on a new journey, which is help found a hospital where the vision of the owners is to marry luxury with with high quality clinical care. So and this is where I've been for the last 3 years.
Thank you for sharing your journey. It's fascinating. You did academic medicine, you did private medicine, and now you're also involved with startups. It's quite a journey and quite an arc. What did you find the most rewarding and maybe the most challenging in each different sector, if you want?
I think that the major sort of to say limitation was in my own personal awareness, meaning that I did not have enough awareness during that journey to certain facets in my character and personality. Mainly, for example, in my continuous huge appetite to learning and getting, learning something new, and the challenge about that. And I'm saying that, this lack of awareness was actually the biggest challenge, because it kind of like, in a way, differentiated me from the environment that I would be working at. But most of the time, it had its own negatives also. So, and the negatives primarily arise from the fact that I lacked awareness that this is something that was very particular to me in comparison to my peers. Although some of my closest peers would draw my attention that whatever I would be fascinated and working on is not something that's common. Because as I told you, when I started working in the field of AI 14 years ago, we had difficulty finding journals to publish our work. They literally didn't understand what we're saying. So, and you start thinking and wondering, why are they, kicking our article from one journal to another, and it takes us like a year and a half to publish something that we've already done. And by then I would have been, bored actually, and have found myself a new toy, a new, challenge. So eventually, I recognized that this is something in my character, and that this is the sort of, to say, given order of things in the environments that I've worked at, and that it's such that, yes, when you're someone who is always working at the forefront of technology, and learning something new, you're definitely going to be different, and therefore you're going to be both an opportunity and a risk for those around you. So, but all of these, it took me some time to understand them, and but once you do, you kind of like take advantage of that and start building on it positively, and to minimize the negative unintended consequences of it.
Right. Yeah, Dr. Ismaeel, you've been very, very busy with clinically, I guess, and administratively, right, at the Amman Hospital, recruiting physicians and stuff like that. And so, despite that, you've been also pursuing your AI sort of career focus through getting certifications, and then you embarked, I guess, on, we'll talk about it in a bit, but you embarked on a startup too. So what got you into starting with a startup at this point, in addition to the other work that you're doing?
Yeah. So the primary driver was actually to address, my internal need to sort of like get back at the things that I saw hurt my career. Okay. So it was like always a hovering question: what if I had this tool? If I have this tool, how would it have contributed, for example, to changing my career, or altering the way I practice? So the available tools out there, especially in the field of artificial intelligence, they do not address matters in a way which is comprehensive and integrated. They're very much fragmented, and that's expected, because the field altogether is still booming as it is right now. The first experience was at AUB MC, actually. We together with a different group other than Imad, I developed this tool, which is basically how I used to describe it was it was the Jurassic Park experience, meaning that ECGs, electrocardiograms that have been photographed and stored as PDF images in archives for the last 60, 70 years and are of no use, neither for research nor perhaps clinically, are sitting out there. And what I wanted to do was, what if I can bring these ECGs back into life? And hence the Jurassic Park, simile that I use. If I bring this ECG, which is stored in PDF, and enable it through AI to bring it back into a time millivolt curve in a data spreadsheet such as Excel, for example, and then take that information, reanalyze it based on the knowledge that we have right now. Look at the outcomes of the patients over the last 50 years based on these electrocardiograms. I mean, that's a huge wealth of data that we can mine and get results out from. So we did that. We patented it at AUB, and then after I left AUB, a guy from San Francisco sent me an email, just a random guy, saying, hey, we looked up this and we think that our company can make use of this tool for a different use case. And I was like, wow, well, what do you need it for? And he says, we're developing a vest defibrillator, and we need to train the AI model in it on different arrhythmias, and there are very rare arrhythmias that are not stored in digital format. All what we have for them is in PDFs, and therefore we need your tool in order to digitize these PDFs, bring them into a digital format so that our own AI algorithm can actually train on them. So when this when this guy sent me that email, which was around maybe 2 years ago, I was like, you know what? I really tried to commercialize the patent myself along with the team, but we were in the wrong ecosystem. Unfortunately, even when you are innovative and create something which is of use, if you're not in the right ecosystem, it will not be cultivated. It will not grow. You will only find it difficult to grow it. So that was this experience. And once that guy reached out to me in Qatar, when I was here in Qatar, I was like, okay, you know what? I think it's now or never. Let me just talk, to my trusted partners in crime, and let's go ahead and found, this company, which is Healtech. And we'll do education, training, consultancy, and solution development based on our experience. And that's what we've been doing. And it's been a tremendous journey, especially both the educational training arm and the development arms. Because we've met and trained really, really fantastic people who are eager, and we were happy with the fact that we kind of helped guide them on how to properly evaluate and use AI in their own systems, and also in the solutions we developed. But eventually, the flagship solution was SOLVIT, and this is what we will be talking about. Contrary to all of the other solutions that were sort of, to say, high-risk solutions, this is a low-risk solution as per FDA criteria. It's more for a clinic management solution that utilizes software as a service. And we have AI incorporated in it. So we decided that this solution is not going to be sold out for others. This is something that we want to actually operationalize ourselves.
Uh, I really appreciate your honesty, and I appreciate how self-reflective you are. A lot of the times, people, when they talk about their journey, they make it sound that everything was intentional and everything was planned. But I really appreciate your honesty by saying like there were like some random encounters and how you pursued certain things without knowing where they would get you. It gives you something to think about. Uh, do you want to talk a little bit about your partners and who helped you along the way? Maybe did you have any mentors, or were you really figuring it out as you go? Did you benefit from, you were talking about the ecosystem in Qatar, did you join any like accelerators, or do you want to talk about that process maybe?
Yeah, sure. In terms of mentors, unfortunately, not in the AI field. I had partners over there, not mentors. Um, However, in the clinical field, of course, I had mentors and people who I highly regard and respect a lot, especially Professor Samir Alam, who remains extremely close to my heart. But in AI specifically, no, I didn't have mentors. It was us learning on the go, because when we started, it was still very early. Mind you, that the reason AI, we have to be very honest. The reason AI has been there for the last maybe 70 years now. However, we started hearing about it so loudly ever since OpenAI launched ChatGPT, and people started seeing, what are the capabilities of a large language model. AI was present, 65, 67 years prior to that. But this was the first time that, the common person was capable to interact with AI through spoken language or typed language. And that actually was a major disruptor in the field, because it kind of like showed the possibilities out there. And with these possibilities, there's always risks. And the primary risk everybody was concerned about was loss of jobs. So hence, with fear driving it, I think everybody started talking about AI. And it was kind of like the right timing for us to kind of like push forward in our company and our solutions to capitalize on the marketing that was happening and continues to be happening right now, and find for ourselves an area where we could present something that can actually address a problem that many of us have in the clinical field.
Yes, yeah, and so basically, like a startup is a big endeavor, whether it's in AI or in other fields. So how did you navigate the system in Qatar, I guess, and maybe outside Qatar, to be able to initiate this startup and make it successful?
Well, it's not successful yet, but we're hopeful.
We're rooting for you.
So yeah, the startup is actually incorporated in the US, in Texas. I'm based in Qatar, and officially I'm a co-founder and advisor for strategy and healthcare operations. This is what this is my contribution for the solution. So I don't hold any true administrative roles. It's just at the higher level. Now, the question is, what you're asking is how difficult it is. Well, it is difficult. It is difficult because there's always risk, and there is a saying that goes around that the largest cemetery is the cemetery for startups. Okay, and that's true. Okay, and right now, especially, if you wanna have an analogy, with the videos that are currently present on your phones, everybody suddenly became a host. Everybody suddenly became, interested in videography and journalism, etc. Similarly, now with AI, everybody is interested in jumping and becoming an AI specialist and having a startup in AI, and but our startup has a unique feature. The people, me, Imad Al-Haj, Eli Shair, Ayman Qaisi, and others, we're not like your typical young individuals who just like graduated. This is not our story. Okay, this may be a different people's story. Our story is that we are basically in our late 40s to mid 50s, who have been doing this as a service for others, and then eventually thought about an idea and said to themselves, this is the idea that we think can become the next successful story. So with that said, it takes a lot. It's a lot of hard work. It's a lot of hours. It's a lot of planning. The development component of it is very fascinating, but however, it is basically not the most difficult. The most difficult components are those that are beyond development, which is basically the go-to-market plan, the marketing, the pricing of the solution, the positioning, the regulatory aspects. Finding the funding and the investors. These are the most painstaking components of it. The development is fun, when you're developing and working with the engineers and asking them to kind of like implement what you think is needed in the market, and then bringing the input from others is very fun, actually. One interesting thing is maybe that people need to appreciate is so when we were testing our solution with a group of physicians, there happened to be you need to have in this group someone, or many of them actually, who are quote unquote would be labeled by someone who's tech savvy as lazy individuals. You want the lazy individual to be in that group, because the lazy individual will always be looking for the fastest way to accomplish the job with the least effort. Okay, so if you are capable of actually delivering to that, accomplishing the task in the fastest way with the least effort, it means you've actually delivered something of value. Okay, so you want the lazy individual to be in the group of testing your solution in order to gain from their insights. And that's a huge paradigm shift, by the way. We as hardworking individuals, we kind of like think that it always has to be hard work, hard work, hard work. Well, okay, but if hereby comes somebody who figures out how to do it simply, I mean, you should appreciate that, because this is the definition of cost effectiveness, So yeah,
Work smart, not hard.
Yeah. Honestly speaking, I mean, you gain a lot by having these people among the group testing your solution, because if they give you the thumbs up, it means it's a good solution. If they say, on the other hand, you know what, your solution is complex, or it takes time from my clinic, or it's hard to use, or whatever, then you'd better not even invest further. You stop over there,
Right, and I think you become too, if you don't implement the solutions that make you faster, even if you work hard, you're going to be behind other people who are working less and probably ahead of you in that case.
Yeah. No, the whole idea behind AI right now, and at least in our solution and those similar to it, is basically to enhance operational efficiency. It's how you can accomplish more tasks with a higher quality in a lesser amount of time. Okay, So, and then at a later stage with a lesser number of employees. This is the reality of the situation. So if you're incapable of delivering that, then you haven't grasped the idea correct.
Can you give us an example of like how you would integrate it in the workflow? Are you able to? Is it customized to Arabic speakers? Is it customized to English speakers? Is it flexible?
Yeah, so let me first, tell you a little bit about the solution. So the solution is, it's as simple as it gets. It's an electronic medical record system with a customer relationship management module, where we've also integrated WhatsApp fully in it. We've developed our own AI virtual assistant. We call her Ava. So Ava is an AI assistant which is that's focused on the patient provider communication module. So it works in that touch point. Okay, this is our own IP. Now we've also integrated and will actually deploy that July 1st, coming July 1st, Google's Gemini Turbo. And we're doing it, as per the cybersecurity requirements for healthcare, for HIPAA compliance, etc. So that would open up, the whole healthcare suite to be used. Okay, so what we're aiming for is effectively to work against the current tide in the AI business model. Okay, and let me explain to you what I mean by that. The current tide is, say, for example, if you look at the process between patient registering and being scheduled, then checking in, being checked in, then brought into the clinic, evaluated, then, walked outside of the clinic to continue. It's a whole process and journey. Right now, what's happening is that each company out there is focusing on a small part of that journey and giving you an AI virtual assistant that helps in that part. Okay, so what's happening is that they come to you as a provider and say, hey, we can help you. For example, if you integrate our solution, it will register. I'll give you here an example. It will audio to text, right? Your conversation with the patient as you're actually taking the history and performing the physical exam, separate them, and then write them into a note and suggest to you, for example, a differential diagnosis. Wow, that's amazing. Okay, how much does this license cost? Oh, it costs around $300 per month as a license. Okay, and then you have another license for scheduling patients, and then which costs another $200 per month. And then you have another license for education, patient education. And then you have another license for, reminders. And then you have another license for analyzing the data and generating reports and summaries, So it ends up what people who are working as per this business model envision providers, healthcare providers, as a cash cow, meaning they want to milk us, okay? And eventually we will be working for them, because if you really want to increase your operational efficiency, you need at least 3 to 4 of these AI virtual assistants. And to pay like something like, for these 4 would be something like maybe in the range of $1,600 to $2,000 per month of licensing. I mean, better as well,
On top of your staff.
Yeah, so
that's like another staff.
Exactly. So right now, this is the current business model in the industry, and what we're trying to offer is something the complete opposite. We're trying to offer one AI to work across the journey. Okay, and so this is one of the key elements of the business model that we're presenting, and it's a tough model. However, we are really doing our best in order to adhere to it. So that's one thing. The second thing is that Since our solution was developed by clinicians for or providers, because it's not only for doctors, it's also for physiotherapists, dentists, dietitians. So all healthcare providers can use it. Since it was developed by providers who have a very strong understanding of the local practice, especially the private practice, the workflow incorporates our own workflows over here. Meaning, if you compare, for example, a solution that's developed for North America or Europe, over there, the practitioners do not provide their personal phone numbers to their clients, to the patients, Whereas over here, if you want to build actually a solid patient base for your clinic or practice, then it is by default expected of you to provide your personal phone number and you're reachable. So, and on top of that, the number one method of communication over here is WhatsApp. This is the
WhatsApp, definitely.
Exactly. So what we did was, given this, understanding, we fully integrated WhatsApp in our solution, meaning that every communication that happens is potentially archivable and directly into the medical record, whatever it is. So in a way, you don't lose that opportunity or piece of information because you communicated with the patient over WhatsApp. And then on top of that, the last thing we wanted to provide was we granted all of our, anybody who participates, we granted them for free full access for a library, for the largest library of patient education material you can imagine. It's Medline. So Ava, our virtual assistant, enables you to pull out of Medline every piece of medical, patient education or instruction that you desire in order to present you with the options that you want to share with your patients. So these are, the key selling points in our model.
Yes, yes. So
and when you build it, is it for clinicians who work in private practice? Is it for group practices? Is it for big institutions? Like, who's the client that you had in mind?
Well, it's definitely not for hospitals, and it's for everybody else. Okay, so primarily, as the name SOLVIT, it was envisioned to solve my own personal problem. Okay, so and what I wanted was to encourage physicians to go into private practice and to help them undergo the digital transformation and use AI to the maximum. They can use it, for example, for data analysis. They can use it for marketing themselves and launching campaigns. They can use it for, everything that can really make a physician or a practitioner succeed in today's market as an individual, solo practice. So it's for practitioners, it's for polyclinics, and hospitals can use it if they have a system which is interoperable with it for their outpatient department. So this is the primary, segment that we're approaching. Now, on top of that, for example, say NGOs, people who want to do research and want a research database, they can also use it as a research database and use all of its capabilities.
Is this what you wanted to talk about, SOLVIT Gratis and SOLVIT Prime? Is this part of the solution?
Yeah, so actually, so our solution, we have the standard balanced tiers where, basically you get a license, for example, for single user. You can get a license for 3 users, you can get a license for 5 users, for 10, and then you go up beyond that into enterprise licenses, and you pay a subscription, which is very minimal compared, it's at 0.2, whatever is out there in the market. And then, however, you pay as much as you consume in terms of storage, data, tokens, and WhatsApp messages. So, but on the side, we actually have SOLVIT Prime. SOLVIT Prime is our gift to all nearly graduating, meaning physicians or practitioners in their final year of training, or just have graduated. 2 years of subscription free. So they basically, it's for free. They get it, and they just pay for whatever they consume, which is minimal. It's not expected to go beyond single-digit dollars per month. They get full access to that, and they can, it's to help them build their practices. And this is what we as a company want to see. We want to see private practices flourish, and for that to happen, we wanted to help the fresh graduates. So that's SOLVIT Prime. SOLVIT Gratis, on the other hand, is offered for healthcare providing not-for-profit, non-governmental organizations, especially, what we envisioned or had in mind were organizations that operate in areas of crises, like in Lebanon, Sudan, Libya, Gaza, whatever. Okay, these doctors over there, or providers in general, especially groups of them that work in not-for-profit organizations who want a solution that can ensure there is no fragmentation of care. Because mind you, the biggest challenge over there is to ensure continuity of care, especially when some crisis happens. So if they want that, again, we're offering that to them at zero subscription fees. Of course, after we do the due diligence for verification of use, but they get it at zero subscription fee, and they just pay as much as they consume again.
So these are the WhatsApp bot, does it support Arabic or just English?
So currently, the solution is in Arabic, English, and French. Okay, so
wow.
Now some of the functions, because they're dependent on outside sources, are restricted in terms of language. For example, the patient education, you can get it in English and Spanish because that's how it is in the library.
The library.
Yeah, but the solution itself is in 3 languages: Arabic, English, and French.
Amazing.
So can you give us an example of, because I think it makes it easier for people to understand it. Let's say somebody gets a license for your solution who's entering into private practice, or somebody in an NGO, and they get contacted by, let's say, 2 or 3 patients through WhatsApp. Like how does the solution work to help these physicians navigate the process?
So first of all, if you're establishing a clinic, you need a place to schedule. So your schedule, okay. You need a place where you can actually write your note. So that's your medical record component. And then on top of that, you have the other, vital components, which are the communication module, which includes WhatsApp, email, and SMS. So say, for example, the question you just asked, let's say I basically, or not me, a gastroenterologist saw a patient and has him scheduled for an endoscopy. Okay, so as soon as he schedules the patient for the endoscopy, he's given, the opportunity to send the patient the education and instructions, patient instructions, because they need to be sent like 24 hours before. You need to stop eating at this time, drink as much as, I don't know how many liters of fluids with the sachets of bowel cleansing, prep, etc. So all of these, they can be configured to be sent, on the time, on the date that need to be sent to the patient. And whatever communication happens, the patient gets back to you on WhatsApp through a message, through, sends you, say, for example, they send you, they've done the CBC, the complete blood count, or some laboratory test outside. They sent you the result as a PDF on WhatsApp. then, as soon as you open it, you're prompted, asked by the solution, do you want to archive it into the patient's medical record? And you say yes, and then it navigates the process for you to kind of like put it over there in a way that is, reachable, and also you can ask the AI tool to parse some data. So say, for example, you're gonna say, I want to know, list for me for Mr. Muhammad Jardaly, how many times he has been having a hemoglobin less than 12, okay, in his data. It would just pull it out for you. So
Nice.
this is in brief how the solution works.
It's like ChatGPT for clinicians.
Yes, but we use Gemini. We're with Google.
Yep.
Okay, so we're kind of lucky. Google, we've been working with Google, and we have we've been accepted as part of the Google Startup Program, and the solution is deployed on Google Cloud. I'd like to thank Google Qatar for helping in that, especially Dr. Shawqi Tawbi. And we're using also Gemini Turbo as the component to provide us with the AI healthcare suite outside of what we developed as an IP.
MohammadAli, do you have further
Amazing.
questions?
No, it makes me want to quit being a employed physician and open my own clinic back in Lebanon.
Yeah, actually, Muhammad, Khalil, I'm sure you probably went through the same experience. So what we incorporated in it was the ability to have a virtual telemedicine visit, and the whole appointment can be sent directly as a link to their WhatsApp or to their email, and there's a payment gateway capability. So I'm sure, Khalil, you've had the same experience with the dear patients that that become dear to you in your practice, and then you probably severed the clinical relationship with them once you left. So imagine had you had this. I mean, right now, you and I and Muhammad, we're three providers, three doctors outside of our country, and our parents or family members are over there. So we're now in the going through the experience of the expats. So imagine having to take care of your family member or from abroad. Wouldn't you want to have a solution where, for example, the doctor, whoever you trust your family to be treated with, to kind of like happen to open for you an encounter where you are on a video call, your parents are on a video call, and the doctor is simultaneously with you, and you know exactly what's happening. I mean, that's this is what we're offering. We're offering basically the platform needed for different types of services to utilize it and launch it, to launch their own businesses, launch their own services. And the potential is great. I personally have high hopes, and the whole team is extremely excited. None of this could have been accomplished without their full support, and we all have extreme high hopes for it.
Yeah, I mean, Hussain, Dr. Ismaeel, this is a great platform. I think that has, to me, it sounds like it has a great potential, especially in the area, because it utilizes most of the communication methods that happen in the Middle East, and it looks like it's going to be easy to use. I mean, the question is, looking forward, will it, and hopefully it will, I think, will it be more efficient? Probably yes. Will it be less costly because you don't have as much overhead anymore? Probably yes, but I think these are things to look at in the future.
Yeah, no, actually what you mentioned are key elements in our business model that we're keen on confirming: more efficiency, more effectiveness, less costly. Right. These are pillars. If we don't deliver to that, then we don't stand the chance to survive the competition. The competition, you know, funnily enough, I was a guy reached out to me from Lebanon, and he was interested in, he's actually interested in developing something from scratch for hospitals. Young, aspiring individual. I didn't want to break his heart, but it's very difficult. It's very difficult to start something from scratch in the wrong ecosystem. And this is what many people don't understand, and especially in healthcare, because when you are a B2B, meaning business to business, you want to sell your product to a restricted number of individuals, versus when you are a B2C, you're the pool of clients who can purchase your service are much, much, much bigger. So you can easily reach, the guy was extrapolating his experience from building an application that has been downloaded across the globe. He said, he claimed 1 million times, and I believe him. I have no reason to doubt him. But there's a big difference between building an application for, with a group with 5 billion people as your potential customers, compared to building something which is heavily regulated and the number of potential customers does not exceed, for example, in a market like Lebanon, maybe 2,000, compared to, for example, in Saudi Arabia, maybe 10,000 or 15,000 somewhere else, So it's like the size, economy of scale, this is what is missing in some people's way of approaching things.
Yeah, and then probably in Lebanon, there will be some political infighting on who he belongs to and who gets the application, who doesn't, all this stuff.
The ecosystem, it all goes back to the ecosystem. Yeah. You might have the strongest will, the brightest idea. If you don't plant it in the right environment, and if you don't nourish it, water it, look after it, it won't grow. It's it's basics, and we tend to somehow. I personally, have been through this. That's why one of the comments I gave earlier to Muhammad Ali before we started, officially the podcast. We need to break out of the cocoons. We need to break out of the cocoons, the mental cocoons that we've been for so long positioned and placed in. There's a much bigger world out there, and unfortunately for us in Lebanon, we're still stuck in that cocoon. Look at, for example, what's happening in the UAE and in Saudi Arabia. There are billions of dollars being injected to promote businesses in the fields of artificial intelligence. Here in Qatar, there are billions being injected. They've already built a regional cloud service for Qatar on Google and on Microsoft, and along with the infrastructure needed, and they have a vision, So you need to be in the right ecosystem. That's an important success factor.
Right. Like somebody told me, actually,
that's solid advice.
Right. And somebody told me, like, you have, when you want to start a startup, you have to have your first customer already. You've talked to them and they're ready to implement it once you start it, because then you can try to gear it towards that customer and then start expanding afterwards.
And you don't build something and then look for the customer. Okay, right. It has to, it's actually so. In my training, by the way, I'm trained in Lean Six Sigma for healthcare operations, and over there, the first thing you learn is you have to start from the voice of the customer. This is the most important voice. Everything that you're doing is for them, and which is a very difficult thing for doctors, to swallow. But in reality, you don't have a practice without patients, and to start with, the mission is to serve the patients. So again, similarly in startups, The first voice that you should be responding to is the customer. If your solution is not built around delivering a service with value to the customer, then I don't know what business you're doing.
All right, thank you guys. I mean, this was a great podcast, I think, discussing SOLVIT and Healtech with you, Dr. Ismaeel. And thanks, MohammadAli, and welcome back. And hopefully we'll be seeing you more often. Thank you very much.
Thank you. Have a good night. Thank you.